Hi, I'm Dr. Larry Stiefel. I'm one of the pediatricians at Tenafly Pediatrics, and I'm here to talk to you today about toilet training. The key to success in toilet training is really patience, namely that you're patient with your child. Essentially, you want to keep a positive attitude and a sense of humor because in toilet training, you are definitely going to need it. Training depends on physical, emotional readiness of your child, not on their age. Some children may be ready as early as 2 years old, whereas other children are not ready at 2.5 or even at 3. It's really a matter of when you sense your child is ready, not their age. Don't start training until your child is ready. A certain time of life may be convenient for you, but if your child isn't ready, it is definitely not convenient for them, so take it slow. Certain clues that your child may be ready will be evident to you. Can your child understand basic directions? That's very helpful. Does your child signal when he or she's diaper is wet, that they have some awareness that it's there? Or do they seem uncomfortable when their diaper is soiled? Can your child stay dry for 2 hours or longer? That's a very good indicator that they may be holding it in and that they may be ready for toilet training. Do they wake up from naps dry? That's also very helpful. Another helpful idea is whether your child can pull their pants down themselves and pull it up themselves. That's very helpful for toilet training. Does your child communicate through words or facial expressions or posture when they need to go? Sometimes they'll even go off into the corner to go to the bathroom. That will give you some clue that they're very aware when they need to go to the bathroom. That is a very good clue that you're ready for toilet training. Okay, so now, before I go forward, let me just remind you that patience and a sense of humor are definitely the way to go, and try to keep your positive attitude. First thing you need to do is buy the potty. It's a very good idea to keep your child involved in the process. So I would take them with you to the store to purchase the potty. The best potty would be something where they can rest both their feet on the ground. That way, if they need to push, they can have their feet in position, and it also gives them a sense of security. Try to make your child's potty chair one of their favorite possessions. A few weeks before you start training, as I said, go out and buy it together. And when you bring it home, you can put stickers on it, you can have them write their name on it, they can even paint it. Anything that's going to make them feel comfortable. Let your child sit on it for days before you start to use it to give them a sense of comfort and a sense of security. Let them think of it as their chair or even one of their favorite toys. They can use it to watch TV, to play games, to read books. All of these things are ideal for toilet training. After about a week, after your child has a good feeling about the chair, you should start considering the practice runs that will start the training. So what do you do for practice runs? Essentially, the first thing you want to do is you want to have your child understand what they need to do. So I would have them come to the bathroom and see a family member or sibling go to the bathroom to get an idea of what's normal. The same sex would be ideal of the person who's demonstrating it, but either way, someone whom they respect or they would want to emulate would be a good idea. You can also take the contents of a diaper and have the child dump them into the potty so they really get a sense of what it's for. Okay, now we're ready to talk about the practice runs. If they show any signs of needing to go, if you see them gesturing like they need to go, or grabbing at themselves, or expressing in any way that they need to go, I would, as quickly as you can, take them over to the potty, pull their pants down, and have them sit down. You can say something like, let's try the potty, let's see if you can do this. Make it seem as fun as possible. Also, a good time to try is just after naps, or about a half an hour to an hour after they've eaten. Be consistent. Make sure all the caregivers do it the same way and that there's a sense of consistency to the potty routine so the child understands what the message is. Encourage them to try to pee or poop when they're sitting on the potty. If they're reluctant to try, do something fun while they're sitting there. Read a book with them or sing a song or do something to distract them. That's always a good way to get them to stay on. Be positive even when they're not successful and try to be very encouraging. If your child wants to get up after 1 minute of encouragement, let them get up. You should never force them, and you should certainly never use physical force when you're trying to teach them about the potty. Even if your child is having fun and enjoying the experience, after about 5 minutes, if nothing has happened, you should still take them off the potty, unless they seem to be successful. Praise or reward for your child for any sign of success or for any sign of cooperation is always a good thing. If your child is resisting using the potty, if they're really giving you a hard time, you should probably take some time off and not even try. 1 or 2 months is enough time, and then try again, because chances are, if they're resisting, they're just not ready. All cooperation for practice sections should be praised. You should say something like, "You're trying so hard. I'm so proud of you." Anything that would be useful to give them a sense of accomplishment would be good. If they are successful, using something like stickers or a small prize or praise or even hugs is a very good idea. For some children, just a sense of accomplishment is enough, but for other children, giving them a reward, a small reward, is definitely a good idea. Let your child do the flushing honors. If they're successful, it gives them a very good sense of accomplishment to take the potty to the toilet and flush away what they've done. If they are more successful, if they tell you when they need to go to the potty, or if they go on their own, you should definitely give them a big reward. Something like going to the ice cream store or something that they would consider a bigger reward would definitely be a good idea if they're really demonstrating skills. Once your child uses the potty on their own 2 or more times, you could probably stop the practice runs. But for the next week, you should still give them very big praise when they use the potty. Practice runs should not be needed for more than 1 or 2 months. Really, they're just a way to get the child used to it. And then once they're successful, you can stop them completely. Accidents are really a normal part of potty training, and you should just get used to the idea in advance that accidents will happen. Essentially, you should respond sympathetically and say to them things like, "You know, you're getting better at this. You're really doing a good job, and you're going to keep getting better." Or mention someone that they know who's successful at potty training and say, "They started just the same way." Try not to be critical. Be as pleasant as you can. Pressure or force can definitely make a 2-year-old completely uncooperative, and that's definitely the last thing that you would want. To avoid accidents, you should probably try regularly scheduled bathroom breaks. Essentially, your child may get easily distracted, but if you set scheduled times for them to go to the bathroom, it'll make it easier for them to have success. Stay calm if they have accidents. Just remember, they are not doing it to annoy you. It's a natural part of the process. Consider changing to training pants from diapers once your child is cooperative and has passed about half their urine on the potty. Take the child with you to buy her underwear, his or her underwear, because it'll give them a sense of accomplishment. It'll be fun for both of you. You really want this to be a fun process and not something that you're wrestling with. Once they start using the training pants, you should probably only use the diapers at night or after naps. That would give them a more sense of accomplishment and security during the day. Full daytime bladder control can actually take a while. It can be up to 6 months before they're really successful. And as far as nighttime success goes, it can actually take years. You really shouldn't expect that they're going to be successful at night for a while. And just be patient. Toilet training can give a child a great sense of accomplishment if it's done slowly and with patience and understanding for reaching a new developmental milestone. Essentially, you should have fun with this with your child and enjoy experiencing this new development with them. Have fun and good luck. Thank you.